The occurrence of skull fractures in conjunction with epidural hematomas is notably frequent, often manifesting at the pterion, which represents the thinnest segment of the lateral skull. These hematomas are induced by traumatic injuries affecting the middle meningeal artery, a branch originating from the external carotid artery and situated just beneath the skull. Due to the firm attachment of the dura to suture lines, blood is impeded from crossing, leading to an inward expansion. On non-contrast CT scans, epidural hematomas typically exhibit a hyperdense biconvex or lens shape attributed to the dural suture lines. The expansion of epidural hematomas inward can exert pressure on and displace brain parenchyma to the contralateral side, resulting in midline shift and increased intracranial pressure. Interestingly, there is often a lucid interval immediately following the injury, during which patients may display normal neurological function. However, the subsequent increased intracranial pressure can provoke severe headaches, nausea, vomiting, altered mental status, and even syncope. Distinct from epidural hematomas, subdural hematomas arise from the tearing of bridging veins that drain the cortex into the dural sinuses, particularly in scenarios involving sudden acceleration-deceleration injuries. Unlike epidural hematomas, subdural hematomas are not constrained by suture lines, allowing them to expand along the skull and adopt a crescent shape on non-contrast CT scans. Chronic subdural hematomas, characterized by slow-onset neurological symptoms, stimulate fibroblasts to form collagen around the hematoma, resulting in an organized subdural hematoma. Chronic subdural hematomas appear hypodense on non-contrast CT scans due to the breakdown of blood and proteins, leading to less dense fluid. Rebleeding or acute on chronic subdural bleeding can introduce new hyperdense areas on CT scans. Risk factors for subdural hematomas include chronic anticoagulation, cerebral atrophy from age or neurodegenerative diseases, and chronic alcoholism. Shifting focus to subarachnoid hemorrhages, these involve bleeding into the cerebrospinal fluid space between the arachnoid and pia mater. The majority are attributed to the rupture of saccular cerebral artery aneurysms, often accompanied by sudden, intense headaches described as the worst headache of my life. Subarachnoid hemorrhages may induce fever, nausea, vomiting, meningismus, and photophobia. Left untreated, they can expand the subarachnoid space, leading to intracranial hypertension. Non-contrast CT scans in subarachnoid hemorrhages reveal hyperdense material filling the subarachnoid space, especially near the circle of Willis. Lumbar puncture in subarachnoid hemorrhages shows an increased red blood cell count and observable xanthochromia, imparting a pinkish-yellow tint to the cerebrospinal fluid due to hemoglobin breakdown products. These breakdown products can cause endothelial irritation and vasospasm, potentially leading to ischemic strokes. Nimodipine, a dihydropyridine calcium channel blocker, is administered to prevent vasospasm following subarachnoid hemorrhages. Cerebral aneurysms, responsible for most subarachnoid hemorrhages, often form in the anterior circle of Willis, particularly at the anterior cerebral artery-anterior communicating artery junction, where turbulent blood flow is prevalent. Postmenopausal women are more susceptible to cerebral aneurysms due to decreased estrogen levels, leading to weakened vessel walls prone to aneurysm formation or rupture. Additional risk factors include smoking, excessive alcohol intake, and vascular Ehlers-Danlos syndrome, characterized by defective type 3 collagen in vascular walls, elevating the risk of cerebral aneurysm formation. Autosomal dominant polycystic kidney disease is also associated with cerebral berry aneurysm formation. Thank you for watching, and be sure to talk to your healthcare provider if you have any questions or concerns about your medications and any health conditions you may have. Disclaimer: the information presented in this video is for educational and informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you hear or see in this video. We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. They also provide catering services for events and have a selection of fashionable clothing items for sale. Message them on Instagram at Coffee First Cup to receive generous discount codes.